People still say the opioid crisis, even though that term is really kind of outdated and not really correct anymore, right? Because it's really a drug crisis. It's an overdose crisis. It's an addiction crisis. But opioids are just one piece of the picture now.
An epidemic of overdoses has plagued the U.S. since the late 1990s, when pharmaceutical drugs like Oxycontin led to the first wave of this crisis. Subsequent, increasingly deadly waves would occur when prescription drugs gave way to heroin use, which was then overtaken by synthetic opioids like fentanyl. Around 2019, a new wave began that would be even worse still.
The fourth wave, I think the definition of it is still being debated. I would personally define it with a few different characteristics. So the first thing is what we call polysubstance use. If you talk to people, it just hits you over the head that people are switching to mixing opioids and methamphetamine. I mean, it's impossible to not notice if you just hang out in a harm reduction clinic for 2 days.
Folks have become increasingly unhoused. As a consequence, you can see a use pattern where folks will be using an opiate to deal with the physical dependence that comes with opiate use and to stave off withdrawal symptoms. And then at night, they'll not want to sleep because it's not safe. And so they might use a methamphetamine then to sort of stay awake at night so that they won't be assaulted or have their stuff stolen.
Combining drugs that have very different effects can be extremely dangerous.
The effects of one mask the effect of the others. It turns out stimulants can also cause death. So, for example, methamphetamine and cocaine, they can cause stroke, they can cause heart attack. And sometimes when people use them in combination with opioids, which have an opposite effect of the stimulants, kind of relax them, they use higher doses of the stimulant in order to get the same effect. That puts them at higher risk for heart attack, for stroke, for the causes of death from the other drug, and vice versa.
But it's really not just methamphetamine. It's a whole host of synthetic drugs. So you'll think you're buying something, it might be called heroin, it might just be called something else, some other random name, but what it really is fentanyl mixed with, for example, a synthetic benzodiazepine that makes the effect stronger, with xylazine, which is a horse tranquilizer, with many different things, right? So there's novel synthetic cannabinoids, novel synthetic benzodiazepines, other opioids that are not fentanyls but are very strong, and all of these things are being synthesized, mixed into fentanyl, and sold in kind of pre-packaged formulations. But if you have to pick one factor, the key thing is the drug supply getting more toxic. And we've seen that in every aspect of this crisis.
Social distancing and remote healthcare during the COVID pandemic made it much more difficult to treat drug users with some of the most effective tools, such as the overdose reversing drug naloxone and buprenorphine, which is a drug used to treat opioid dependence.
And then layer COVID on top of that, which really disrupted the street markets and made it even more dangerous because the suppliers couldn't always get from the people they're used to getting from. People who are buying from certain suppliers or dealers might not have access to a certain dealer at a moment in time. COVID really changed law enforcement. Police didn't want to get involved with people who were dealing drugs because they were afraid for their own health. And so, drugs kind of were able to be sold and go across borders in a much less monitored way. But then unpredictably, all of a sudden, law enforcement steps back in and tightens up. So lots of unpredictability and instability, and that's really bad for public health because there is such a fine line between used to get a certain effect on your body that you're looking for and overdose, fatal drug use.
The fourth wave is also marked by an uptick in racial and ethnic inequality.
We're really seeing it's communities of color that are bearing the brunt of this crisis now. So in 2019, the Black overdose death rate caught up to the white death rate, and in 2020, it overtook it considerably by a large margin. This is certainly not a white problem, right? I think that narrative of addiction as a white problem is actually something that's been really harmful.
Poorer access to buprenorphine medications for sure for Black and brown people means that people will continue to use illicit drugs longer, and then as you're using fentanyl, your odds of overdosing continue to sort of escalate over time. So I think that's most. So it's that combination of changing drug market and then the persistent health disparities in terms of who gets access to treatment.
So look at the fact that Black Americans have been 6 times as likely to be incarcerated as white Americans. Those of us who are in this field have reported for many decades that the risk of overdose is extremely high for people who have just been released from prison or jail. Their body's tolerance to opioids wears off. By the time they're released from jail or prison, their body is back to baseline in terms of how it responds to opioids. This puts them at much higher risk from any opioids they might take. They often don't have health insurance. They don't have health care. They don't have social services. And this is the 2019 moment. If they do relapse, they're buying drugs on a much more lethal market. So all these things together, that's the perfect storm for overdose.
Experts believe that the recent popular support for needle exchanges, decriminalization, and other harm reduction methods could help curb overdose rates in coming years.
I am hopeful because there have been limited amounts of progress politically on the topic of drugs. One thing that's very encouraging is that decriminalization of drugs is wildly popular in the United States. Unfortunately, we don't live in a country where wildly popular things are actually enacted in law, right? I mean, unfortunately, I'm not very hopeful that we are going to be able to resolve the crisis right now. I fear that it's going to get worse before it gets better because we're still not seeing the kind of coordinated political will that we need to implement big structural changes.
I see a lot of hope moving forward in the form of the innovations of people on the grassroots level. A lot of people aren't well served in traditional biomedical clinics. They've had very bad experiences of being discriminated against as people who use drugs, as often as people of color, poor people. And by putting treatment services in trusted community organizations, you increase the accessibility of the treatment, you change the nature of the treatment itself, you change the makeup of the treatment teams. All of a sudden they're encountered with people who have similar experiences to theirs, who are their treatment providers. That's a very different kind of experience. It's a social movement to embrace people who are really marginalized and to eventually get them into the organizations as leaders and as care providers. That's a real shift. So that's what gives me hope.